before you even get started, is you want to hook your suction up. If you look at the top of this canister, it says vacuum. Well, that's where this one goes. So it comes off of here to there. Then it says patient on this one. So you hook the other one here, and the other end of it will go to your NG tube. We have a pump in here, a compressor, that will give us suction, okay, that I have to turn on. In a real hospital, you always have suction, wall suction. So this will make a little bit of noise. And then to make sure that I have it's on off, okay, and it has an intermittent right here, or regular. Intermittent is just like it'll suction on for a little bit and then come off, and most doctors order intermittent suction. And what that does for you is you've got this NG tube in here. If you left it on, if you left it on the on position all the time, it could stick to the side of the stomach for the hickey, or it can cause an abscess or whatever. So by intermittent suction, it'll suction and then let off, so that the actual NG tube won't stick to the side of the stomach. I always start off with regular though. So if you look, I'll put my thumb over here. Okay, and the doc usually wants low intermittent suction. Low would be kind of in the green range. So you just I just set it there. Once I take my thumb off, it'll go off. If you look at intermittent, I'll put my thumb on there. It should come on and go off intermittently if it's working right. See how it comes on? Mm-hmm. And then it lets off. You see that? So that's called low intermittent suction. That's the most common kind. So for your checkoff, you're going to need to know how to hook this up to low intermittent suction, okay? So it just suctions briefly. You see how that works? Okay. Me personally though, I always start off on regular. Okay, if they're really distended, they've got a lot of content in there, I'm just going to want to go ahead and I'll suction it until I don't get any more content, but I stay with it, and then I'll put it on there. But you want to have your suction handy. Let's see if we get tape over here. Got some? Okay. We secure it with tape to their nose. So you'll need to cut your piece of tape. And tear it like this. All right? And stick it somewhere that you can get to it when you need it. Okay, so I've got my NG tube. Do my NEX. So there, I'm going to make a mark with my Sharpie. There, I'm going to make a mark with my Sharpie, and that's the mark I'm ultimately going to go to. So the head's tilted back, so I'm just going to put this in and just tell them they're going to feel discomfort, okay? And put this in until I get to my E mark. Then I'm going to have them tilt their head forward, and then I'm going to ask them to swallow, okay? I actually have to hold his head. What I like to do is have my hand kind of over their face, and as I push it in, I hold it so it doesn't come back out as I'm getting another grip on it. And then I'll push it in, and it's already in as far as it's going to go, okay? So you tell them to swallow, and right when they swallow, push. They swallow, push. They swallow, push. They're going to get red in the face. It's uncomfortable. They're going to gag. All of that sort of stuff. That's normal. We don't let that stop us from getting this in. If we do, we're just prolonging the agony. Let's get this stinking thing in. Okay, so once I've got it right there, I've got my tech. Tech? Would you hold this right here? Okay, where's that syringe at?
Over there.
Oh. You want to have this with you. And again, so I've got it clamped, and I always put it in clamped like this. If I'm going to unclamp it, you got to hold it up like this. If you unclamp it down here and it is in the stomach, there's no need to do this anymore, but you're going to get gastric content all over the bed, all over them. That's not good. So you hold this up, okay, like this. Put about 30 mils of air in here. Unclamp it. Put this in. Once that's in, it's just as good as being clamped again. You can set this back down if you need to. Put your stethoscope on. Okay. Put my stethoscope here, and I just go like that. And you'll hear it. You You can actually hear the air going in. This is right over, your stethoscope's right over the xiphoid process, and right where the tip of that ought to be. You put an air, you'll hear a whoosh, gurgle, you'll hear something. Now, you can't be putting the air in like this. You're not going to hear that, okay? So I like to hold my hand like this, because if you go like this, if there's enough back pressure in here, it's going to cause this to pop off, and then it's like leaking all over the place. So that's why I do it the way I do it, okay? You have to put the air in before you hook it up, okay? And again, I hold it here like this, listen, just like that. Okay, good, I heard air. Now, I've got to take, this is like a splice, okay? So I'm going to take this and move it over to here. I'm keeping this up, and I'm going to hook it right to my suction. My tech has still got a good hold there. We know where, so I'm already decompressing. Okay, I got it. I'm going to put this over their nose, like so. And then I'm just going to wrap one side around, like this. Wrap this other side around. This tape is actually too wide. I use that smaller tape. Wrap that around like that. Okay, then the next thing you do is have another piece of tape. Okay, we want to keep this pulling. So what we want to do is put a loop in here and make a flag. And we safety pin this to the gown. And that way they've got room to move their head. It's not going to pull on it.
So their nose is supposed to be completely
Say it louder.
Is their nose supposed to be completely covered? Or no? Or is it
Well, the
just
tape
a
is
big
that tape is too wide.
Okay. I was
It
just making
should
sure.
only cover here. That's why I said usually the tape that I use that clear tape. Some hospitals have, which I like, they actually have devices. It's like a butterfly shaped thing with a plastic deal on it. It snaps around. It's like a plastic ring. You just snap around it. I love those, but most places don't use them. So anyway, so no, that should not cover his nose like that. The tape is too wide. Okay. And then we got it to low intermittent suction, or it's on full suction. So it's on full suction. You should see content coming through here. It could be any color. If it's blood, it'll look like coffee grounds floating in water. It'll be really brown, coffee ground looking stuff that'll be going in here. And I just watch it. I had a guy come to the ER one time with a GI bleed. This holds a liter. I filled up 4 of these on him, just one right after the other, before I finally put it down on intermittent. So let's say it's good. You're not getting a constant flow through there anymore. We don't want this thing making a hickey on his stomach, so we'll just put it over to intermittent. But remember, before I ever got started, I had my thumb over this thing. I set my pressure on regular right about where I wanted. The doc wanted it low, so low would be anywhere in the green. So I always set it kind of the high end, and I've already got my pressure set. So whenever I cook this up, like I said, it's going to aspirate or yeah, it's going to suction out his stomach. Whenever I get ready, I just put it over on intermittent, and I don't have to do anything. The thing you have to remember is, anytime you disconnect this, you have to hold this above them. Okay? If you don't, if you're holding it down here, we're going to make a mess. Okay? So let's say now, and a lot of times when they're like this and they're actually on suction, you're not going to give them any feedings, because you put the feeding in, you're just suctioning it right out, right? You're not going to crush up any pills and put it in there with them on suction, because you're going to suction it right out. So generally what will happen is, once we get them decompressed to a certain point, if the doc wants to pour in some medicine, you'll take them off suction for like 30 minutes after you give the medicine, to let the medicine pass through the stomach, and then you'll hook it back up to suction again, okay? So let's say the doc wants to give medicine. So let's call it a liquid. Let's call it Maalox, okay? He wants to give 30 milliliters of Maalox. So what I'm going to have is that other thing. Putting stuff into the stomach, you can use this or any container. But put stuff in the stomach, you can just use tap water. Okay, it's nothing sterile. We drink water all the time, right? So I'm going to have water in here. I'm going to have my crushed medicine in one of those little medicine cups, right? So what I'm gonna do is kind of pour the water in the medicine cup, try to stir it up a little bit, okay? I'll have a bedside table here. So I got water in my medicine cup, I got the medicine nice and crushed and dissolved. So what I'm gonna do is, I'm gonna pull this out here. I'm gonna take the suction off. I'm gonna disconnect it right here, and I'll just lay that over. I'm gonna put my syringe here. I've got my little cup with medicine in it. I'm gonna pour that in, and you just hold it up and let it go. If it doesn't go, just like with the enema, just hold it a little higher. Gravity will make it go. Once the medicine goes in, then I'm gonna pour 30 mils of water in here. And you got a thing on here, so just pour 30 mils of water and let that go in. And that flushes out the NG tube. You do that for every medicine. Let's say the guy's been on this for a couple of days and he's not on suction anymore, and the doc wants to feed him, like Boost or something like that, give you some kind of dietary supplement, give you some nutrition, and he'll order however many milliliters of Boost. You just measure them out, pour it in, let it run down, pour it in, let it run down. You have a pre-measure, pour it in, let it run down. So that's your nutrition going in. Once you get all the nutrition going in, then 30 to 60 mils of water again to flush it out, okay? You never plunger it in there. It should, if it's gravity, should take care of it, okay? Unless it's clogged, and it shouldn't be clogged if we're flushing it out like we should. Okay, so then I take this loose again, okay? And I'm not gonna hook it back up to suction. The doc wants to put this on my table. The doc wants, we gotta clamp it for a little while to let that medicine go. So I pull this off, put that there. Now I'm clamped. I can do anything I want, and it's pinned to his gown. A lot of times I have a pocket, and I'll just stick this in the pocket so it doesn't get in the way. Or if I got to transport them anywhere, take them off, that's clamping. Just stick it in their pocket. Okay. Any questions about the NG tube and suctioning? So the key is I like to have everything set up and ready to go before I even start, and I just put my suction tubing right here, and then I can just. Actually, what I actually do is I take. Just like I did before. Once I got it secured, I know it's where it needs to be. I just make sure just don't lose this little splicey deal. And I'll tell you another secret, if you push it in there too hard, it's harder than the devil to get it back out. So I don't over push it, okay? And now I'm ready to suction. How often do you flush it? How often do you flush it? If you're doing suctioning, you never flush it. You just continue to suction. If you're putting medicine in, you flush with 30 mils of water after every medicine. If you're putting nutrition in, food of some kind of liquid diet of some sort in there, you'll flush it after you get done.
So you only flush it after you give them something?
Right. After you flush it, and then you clamp it, but you can't have them on suction. There'll be an order. It'll say give them whatever PO, whether it's nutrition or medicine, and it'll say clamp for 30 minutes afterwards. So that's clamping, okay? I've seen students do this and try to hook this up. So they've hooked the NG tube up to the vent. It doesn't do a stinking thing. They lay it down there, and in the real world, stuff would come all out, okay? This is the vent, okay? And all you have to do to clamp is just occlude the vent. That's what this is. The vent's occluded. Now it's unclamped. We've got air that'll go in there. It'll let content come out, okay? Any questions on the NG tube? When we practice this, I'll be in here. I'll help you guys to do it. It's a lot. I didn't have the table set up right here, so I'm running around. Didn't have the right tape and all that sort of stuff. Okay? So you need to do a lot of practice with this. A lot of practice. Where's the checkoff sheet? Here. No. What's the next one? Anybody got a checkoff sheet?